Dr. Kerr, where did you hear about Receptor-Based Essentials, or RBE?
Well, I was already familiar with Carrick Institute, and so I actually called down here and talked to Jessica, I talked to someone down here, and they said, well, you need to ask Freddie's what's going on and what's the best thing to do to get back into the program. And when they got back to me, they said, Freddie said, you need the RBE program. And to get that transition from chiropractor over to neurologist. That's what I did.
Did you have any apprehensions about taking the program?
I did not have any apprehensions. I was confident in the slope of the learning curve, that it would start out basic and grow to something that was more clinical and something that you could get right into at the office there, and that's what happened, and so it worked out really well.
Can you tell us about one patient that you were able to help differently after taking Receptor-Based Essentials?
Somebody that I could help differently, absolutely. I actually had a woman who came in who had fallen she was at a bridal fair or something, and with her daughter, and she had fallen, slipped off a chair, and previously I know I would have only considered the musculoskeletal aspects of treating her, sacral problems, some upper cervical. However, when she came in and I did, at the time anyway, what I considered to be a full neuro exam on her, which I had learned through the RBE and Carrick, that I saw the neurologic compromises that led her to fall rather than treating her for the fall. And so we did the musculoskeletal rehab on her, which she needed because she'd been injured. However, we also helped, at least mildly, because I didn't have a lot of time with her, with the neurologic aspects to make her more steady, that she would not fall again, or at least make it less likely.
Do you think that Receptor-Based Essentials was worth the time and financial investment?
So I think that the Receptor-Based Essentials is absolutely worth the time and investment. For me, I know that it was the transition from being a musculoskeletal chiropractor and doing a personal injury and your routine chiropractic patients, low back pain, headaches, to what I wanted to do, which was the neurology. I wanted to do a less physical job and a more brain-based job myself. Getting a little later in practice years here, and wanted to do something less physical, more mental, and maintain my abilities to help people and work in the clinical setting on into my later years.
What would you tell somebody who's thinking about taking Receptor-Based Essentials?
Somebody who's considering Receptor-Based Essentials, I don't see how they could go wrong, because it simply expands on somebody's clinical skills. I don't care where you are in your time in practice, let's say, whether you're new or you've been in it for a while. You can't go wrong taking it.